Okay, so now this is the third video in my series regarding beating Lyme disease. So I'm going to talk a little bit today about finding a Lyme disease doctor. So one of the goals in finding a Lyme disease doctor would be to find a doctor that would bring some valuable experience in regard to testing and treatment. And when I say experience, I don't mean just Lyme disease. I also do mean co-infections as well. If you take a blood test and it shows you have multiple infections, hopefully the doctor has some experience in them. Just because he doesn't have experience doesn't mean that he can't figure things out and still provide the testing and the necessary treatment. So your Lyme disease doctor should be able to both order treatment and administer treatment. They may have a nurse administer the treatment, but either way, it should be somewhat of a one-stop shop where you're able to go get things figured out and also get, the treatment needed to get things finalized. So I really didn't have much faith in actual medical doctors at this point in time in my life. So I decided, I was going to try to figure things out on my own. I did this for a few years, and it really didn't work that well. I was still in the same position I had been previously. So basically, I was looking for an answer. I looked online, and I came across a local Lyme disease doctor only about 2 hours from me that basically explained some specific testing and specific treatment that I'm going to go into here as well. So after looking into the treatments mentioned on the Lyme disease doctor's website as much as I could, I scheduled an appointment. When I got there, they took my blood. I talked to the doctor and I told him about my symptoms that I had been struggling with. Basically from there, we made kind of an initial action plan on how we're going to deal with these issues. So keep in mind that your initial action plan is definitely going to change every time you get back a blood test. So I got my blood test back from Vibrant Labs within about 10 days. And when it came back, it said I had basically 7 different strains of tick-borne illness. I believe there was 3 or 4 different Lyme disease strains. There was a couple tick-borne relapsing fever strains. There was Bartonella and anaplasmosis. And now these tests don't just show basically what bacteria is present in your blood. They actually show the antibodies that your immune system is producing in reaction to the bacteria in your blood. So it's really hard to kind of get a clear idea of what's going on. Just because you aren't showing a high number for something doesn't mean that it isn't present. As I mentioned, it may just mean that your immune system isn't reacting to this at this point in time. So the main thing is basically kind of taking each test with somewhat of a grain of salt. I took 4 tests. All 4 of my tests came back, well, the first 3 came back with the same 7 strains of bacteria. The last one, I actually had a few of them drop off of there after these treatments that I'm going to talk about here next. So when I initially got these results, I was very upset. When I had 7 different strains of bacteria and I was going to use this SOT to deal with it, to try to cure and treat my Lyme disease. So as I mentioned, the SOT, they draw your blood, they send your blood off to Europe, and then basically a special medicine is produced using your blood that comes back and it basically seeks out its target, finding each individual pathogen, putting basically a key into a lock in the pathogen into its reproductive system. So these pathogens are not able to reproduce after the SOT attaches to it. Basically, this SOT then works in your body for 4 to 6 months, seeking out and attaching to its target. After it attaches to the target, it moves on to the next target, basically like an assassin going from target to target to target, just seeking out the specific goal, the specific target. So the SOT is an amazing tool, however, very specific, and it may not get all of your target. It may just get the majority, and there may be a couple hiding behind biofilm that may pop out later and reproduce and start all over again. So you have to really kind of keep on it. I recommend taking 2 in a row, or 2 4 months apart. Take one, wait 4 months, take another. This is what I did. I feel like that is probably the best way. So knowing this, I knew it was going to be very expensive. Each treatment is up to almost $3,000, and I knew I was going to need several. So it was just very overwhelming when I first got the results for the Lyme disease test. I knew I had to attack the Lyme disease first, so I focused on that. After that, we made another action plan and we moved on to the next target with the highest numbers on the test. One of the difficult things to deal with at this point in time in my life was that my son actually started to see spiders almost every night before bed. He was hallucinating. I took him to the regular doctor a couple times and they couldn't figure it out, of course. They wanted to bring him to the psychiatric doctor. I scheduled an appointment with my Lyme disease doctor and found he popped up for 6 different strains of bacteria on his vibrant illness test. So after all of this, we basically got things figured out. We got him in there, we got myself in there, we took multiple SOTs. Currently, he's been pretty close to symptom-free for a few months now. I have been kind of dealing with some symptoms, but we got to remember when this stuff is working, when this medicine's working and the bacteria is dying off, the bacteria die-off causes what's called a Herxheimer reaction, which is very similar to the symptoms. So it's hard to tell if it's symptoms or Herxheimer reaction, right? So as I mentioned, you can hit each strain of bacteria multiple times. You can hit it 3 times per year. So if I have Lyme disease, I can hit it in January, I can hit it in April, and I can hit it 4 months later in August. So basically, that would be a good way to make sure that you're hopefully going to eradicate the Lyme disease. That's the goal, obviously. And then, I mean, that's if you don't have any other co-infections and you can afford it, etc., etc. I've heard a person can take up to 9 SOTs per year, 3 SOTs per strain or per bacteria. So you would want to basically get a very clear action plan and stick to it as much as possible in order to minimize time and money spent. So in my next video, I'm going to cover basically some alternative therapies for reducing the Herxheimer reaction. These can be so difficult, almost harder than struggling with the symptoms. When all of this bacteria is dying off, it makes you feel flu symptoms, hungover symptoms, depression, anxiety, everything. So I'm going to mention some things in the next video that can work for that. So please stay tuned and please come on to the next video. Thank you very much.